Welcome to St. Mary Medical Center. You're about to have a state-of-the-art experience in medical education using medical simulation. This video will cover the basic assumption, give you a short overview of how the simulation works and the simulation environment, explain some details about the scenario you're about to undergo, and help you understand how our debriefing process works. The most important thing about this experience is something that we call the basic assumption. We believe that everyone participating in the simulation scenario is intelligent, well-trained, cares about doing their best, and wants to improve. The basic assumption is paramount in your participation in this event today. Please take it very seriously as we are absolutely sincere in offering it to you. Introduction. Welcome to our lab environment. Here, our patient is a high-fidelity mannequin or a trained actor whose sole purpose is to be sick. You're here today to take care of this sick patient. The way you perform here is absolutely confidential, and best of all, it's very difficult to really hurt our patient. And although we are human and expected to make errors, no harm will occur during this event. So please rest easy and enjoy this experience. Afterwards, we'll have a short debriefing session that will go through the scenario and address the educational pearls that may come from it. This session may be videotaped, and we may be asking you to sign a waiver in order to use that videotape in other venues. These sessions will not be sent to supervisors or used for any purpose outside of education. Anything and everything that happens during this session is private and confidential. Your identity will never be revealed to supervisors or other authorities without your prior knowledge. So please feel comfortable to be yourself. The simulation environment. We work very hard to create replicas of the clinical areas in which we all practice. Very often, you may even be working in actual care areas where we take care of live patients. However, despite our best effort, we need to use our imagination in order for the scenario to be realistic. If something or someone is not present during the session, just ask for it. Your facilitator is there to help. If you need to use the phone for any reason, to call a doctor or a nurse or anybody else, please ask the facilitator before you do so. The equipment in the room should be standard issue, and anything that you need should be provided in the scenario. A code cart should be close by if needed, and you should feel welcome to retrieve additional equipment as necessary. However, please check with the facilitator before you do so. Your facilitator is there to help. You may need to interact with other providers to care with your patient. Most often it's another nurse, or it could be physicians, consultants, or family members. Please ask the facilitator for assistance or help before interacting with persons that are not already a part of the scenario. The scenario. Many of your scenarios will use our simulation mannequin. This is a very fancy piece of equipment that truly functions like a live patient in many ways. It can speak, it can breathe, it has common human functions like pulses, reactive pupils, and common signs of cardiopulmonary function like chest rising and heart sounds. And you can also perform procedures on it when indicated. This mannequin can also demonstrate cyanosis and actually have tears. The images show where you can find pulses and how to check pupillary response. If you are working with a live patient, please check with the facilitator before doing any invasive procedures on the patient. In many scenarios, you will also see a monitor. This monitor is fairly standard and comparable to the monitors you're used to seeing in the clinical areas. Some findings are difficult to assess on the mannequin. For example, capillary refill, skin color, or skin temperature. This should not preclude you from assessing these signs. Please check in with the facilitator if you need help with these functions. Debriefing. Debriefing is the most important part of this event. This is where we will discuss the details of the event, what we did well, and what could be improved. This is a safe environment, free from judgment, and in addition to our own learning, helps us improve our care processes throughout our organization. Again, your identity and specific information from this event will not be discussed with anyone outside of the participants of this event. Please proceed to the room now. Ask any questions about the scenario or the environment and get comfortable with the patient. Most of all, if you're not having fun, we're doing something wrong. Please don't be nervous. This session is meant for us all to improve. You'll receive a short description of the scenario now. Enjoy this St. Mary's simulation event.